This is The Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called Preventive Care, the lowest cost dental care there is.
Welcome to the Gum Guru podcast. I am Jason Kong here with Dr. Macon Singletary, and we are going to be talking about, as you just heard, preventative care. And this comes in to affect Dr. Singletary because this is the easiest and most cost-effective way, I think, for us to pay attention to our care.
Yeah, definitely. And when somebody says preventive care, it's interesting when I tell patients that the two most important aspects of maintaining gum tissue health is brushing 4 times a day and flossing at least once, and staying on a good maintenance program. Now, not everybody has to get their teeth cleaned every 6 months, but telling an individual to brush 4 times a day is a lot easier than telling them to stop smoking. Nicotine's an addiction, but it affects your health. Well, so does brushing your teeth or the bacteria that grows, and it can affect your systemic health. And so the preventive care is really one that if it hurts, you go do something about it. I always say it's like high blood pressure and glaucoma. If it hurts, it's curtains. It's too late.
We are often told that to brush and to floss, those are, I think, if you ask folks about their home care routine, what it would consist of. But how would you define preventative care? What should we be doing in your mind? You're the professional here, that would be good preventative care on our end.
Yeah, well, definitely. And so not everybody is susceptible to aggressive gum disease, which is what I do. I do the gum and bone around teeth. But they should get a dental visit twice a year. They should go see their dentist, and they'll do an exam and check for decay and check for periodontal disease. And it's not just that. Dentists, periodontists, oral surgeons, endodontists, general dentists, we all do head and neck exams when you come in, and we do oral cancer screening. We're not just checking the teeth and gums. We're checking the oropharynx, under the tongue. We check where the teeth fit together. Our body takes the brunt of day in, day out exposure to what we eat and the environment. And so the head and neck area is an area that is our territory. And so it's not just looking at teeth. We're looking at the neck, the lymph nodes. When I do an oral exam, and we're taught in dental school, when we see a new patient, we do this. We check the medical history. What I do in my practice, I blend the medical history, the oral exam, and the x-rays, and I come up with a diagnosis, prognosis, and a treatment plan. But I'm catching things like thyroid issues. I look at the neck, and people come in and say, I've had physicians call me up and say, how come you're diagnosing a thyroid problem? That's, patient didn't know it, and this is our preview. This is what we look at. And so if it ain't broke, don't worry about it. That's not true. You want to go and take care of it. You want to, and ignorance is not bliss.
Certainly not when it comes to our health. And the COVID-19 pandemic has had a tremendous effect, of course, on our lives. And I think part of that may have been folks skipping health appointments, whether it's the dentist or the doctor, and making sure that we're getting back into that routine of regular checkups. I think, to go along with what you're saying, really is an important part of the preventative care.
It definitely is. And COVID did wreak havoc on a lot of my patients. I'm sure the medical world will tell you the same thing, although we had professional protection equipment, PPEs. So we were able to see patients, although the American Dental Association wanted to shut down except for emergencies. And periodontal disease, inflammatory gum disease, it affects your systemic health. So even though I shut down my hygiene program, I was there, and I could see people and help them. But people did sort of back off getting health care, and they've paid for it. It's not just periodontal disease. I mean, our teeth have craze lines, and over time, chewing, crunching ice, things that we experience day in, day out, those developmental crazes become more significant. And it's part of preventive care. When an oral exam is done, we look at these kind of things. And I've seen a lot of cracked teeth in the last year or so. And it's because people backed off and said, well, it hurt a little bit. And then if it's caught early enough, and I'm a perfect example of that because I just had a craze liner in a tooth, and I diagnosed it myself, and I'm going, this is not good, and it could be a problem. And so had a dentist friend of mine say, look at it. And I said, I think we need to go ahead and put a crown on this tooth before it does crack completely. But those little issues is part of preventive care, looking at the teeth, looking at the restorations, looking at the care to the teeth. And are there things there that could be headed off at the past? There's some ignorance is not bliss. It's good to have knowledge about, what could happen. And it's not just oral health too, because we go over the medical history. We look at the medication that patients are taking, and medication can affect systemic oral health. And sometimes I see medication done by 2 or 3 different people, and nobody knows that they're prescribing, they're cross-prescribing. And, to have somebody orchestrate that completely, not that I do that, but I'll look at it. Well, you need to look at that and talk to your physician about that. Had a fellow yesterday, he was taking 325 milligrams of aspirin a day as a blood thinner. You don't need 325 milligrams. 81 milligrams does it. You can get aspirin toxicity, tinnitus, if you have that much aspirin on a day in, day out basis. You drop it down to 81 milligrams. So nobody told him. I mean, he's just been doing it for years. And he said, well, yeah, I got ringing in my ears. And drop your aspirin dosage. So those little things are just important. And it will save you money in the long run to be proactive and get a physical once a year. Go see your dentist twice a year. And I see patients all the time that hear the podcast or the Gum Guru, and they'll come in and I'll send them out where they need to go, but I'm checking all that for them. And we make sure that they are aware of what their needs are, and some need to be done immediately, some don't.
Yeah, and preventative care is so key in your world, because I'm sure that you have countless stories of people that you've encountered where you see them and they're in a situation where you look back and say, man, if only you had have come see me sooner, if only you'd have kept up with the regular checkups, we could have avoided this serious situation.
Yeah, and gum disease doesn't hurt. Periodontal disease does not hurt. When it hurts, like I say, it's like high blood pressure and glaucoma. It's curtains. But the signs that you could be aware of is bleeding, swelling, or bad taste. And even if, and some people, they notice bleeding, they back off. And they think, okay, I'm bleeding, I better not do this. You don't want to do that. You want to get more aggressive. You don't want to hurt yourself, but then you want to get that looked at, because called early enough, you don't cure gum disease, you control it. That's because bacteria causes gum disease. It grows back within 30 minutes to have your teeth clean. That's why when you go back to preventive care, what's the most inexpensive part of periodontal therapy or just oral health? You brush the plaque off. It's soft. You don't need a hard bristle brush. A soft bristle brush will do it. You got to floss at least once a day. But that, as far as dental care, oral hygiene care, it's real simple. But then you have to have some eyes on it, because you may have space between the tooth and the gum that you can't get to that needs to be professionally manipulated. And sometimes caught early enough, it can slow down, it can calm down. Once the damage is done, or around your teeth, it's done. Bone doesn't grow back. It's rare that the gum will reattach back to the root of the tooth, but you can slow it down. I've had people come in that because of COVID, and they finally get in and they've got a lot of things going on. And sometimes looking at it, you're going, somebody that hasn't been doing this a while may say, oh, you need to take all your teeth out and do whatever. Not the case. I mean, you get it straightened out, and sometimes people respond real well, and they don't have to spend a lot of money getting it rectified. It's just a matter of catching it, being aware of it, and being proactive.
Yeah, and I think that last part that you mentioned, in terms of the Pocketbook, and preventative care is far more cost effective than waiting to have some sort of major procedure done. If you are experiencing or if you are putting things off, it's going to cost you a heck of a lot more in the long run.
Oh, yes, definitely.
Yeah. So that is why preventative care is so key. And we usually have an action step for us, something that we can take away each program. What is that in terms of preventative care for us?
Get a dental exam, see your dentist twice a year at least. Stay on a consistent recall program that's appropriate to your needs. Brush 4 times a day, and one of those times floss, and don't ignore symptoms. Yeah, they might go away, but that doesn't mean that the problem is going away.
Yeah, that's very, very key. Make sure that you are not ignoring any of the signs that we mentioned. As you said, they can go away, but that doesn't mean the problem is solved. Get a hold of a professional and make sure that you are having those regular checkups and incorporate that into your preventative care routine so that, 1, you stay healthy, and 2, you also keep your pocketbook healthy as well. Well, that will do it for us on this episode of The Gum Guru. On behalf of Dr. Macon Singletary, I'm Jason Kong. Thank you so much for listening to this episode of The Gum Guru.
If you want to know more about how to keep your mouth healthy and your smile bright, or need an appointment with Dr. Singletary, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.